Hi, this is Ariel Vinson, and I'm going to perform the hair, skin, and nails, head, eyes, ears, nose, throat, and musculoskeletal assessment. And these are the 8 pre-procedural steps. The first step is you want to gather and check the patient order sheet. Next, you want to gather any supplies that you're going to need. Then you want to wash your hands. Afterwards, when you go into the room, you want to introduce yourself and identify the patient by checking their name and their date of birth. Then you want to close the door for privacy. Afterwards, you want to explain any procedures that you're going to be doing, and then afterwards you want to raise the bed to the appropriate height. Now let's move on to the first assessment. Now I'm going to move into the skin, hair, and nails portion of my assessment. First, you want to make sure that you have a nice, well-lit room so you can see your patient, and have my patient sitting up here so that I can see them clearly. I'm going to start off with the skin. First, I'm going to inspect the skin, making sure that I don't see any lacerations, any rashes, or any ulcers. Then I'm going to also check the tone of my patient's skin, making sure that it's the right tone for their ethnicity. Then I'm going to feel the skin with the back of my hand, checking and making sure the temperature is warm. I'm also going to be feeling it, making sure that the skin is firm and it's even and it's smooth. I'm also going to make sure that there is no excessive dryness or perspiration. Afterwards, I'm going to check the turgor, the elasticity of my patient's skin, making sure that it returns to the baseline in 1 to 2 seconds. And then I'm also going to make sure that there is no edema just by pushing my finger in their skin. Afterwards, I'm going to assess the hair. For the hair, I'm going to inspect it, making sure that it is moderate in distribution. It's also moderate in thickness. There's no excessive thinning. I'm going to make sure that the hair is evenly moisturized. There's no excessive dryness. There's no flakiness in it. I'm also going to check the scalp and make sure that I don't see any lacerations or any nodules, making sure that the scalp is intact. Afterwards, I'm going to check and make sure that it is clean and free of vermin. And then I'm going to move on to the nails. Since my patient doesn't really have nails, I'll use my own. I'm going to check and make sure that my nails are smooth and they're concave. I'm going to look at the color of them, making sure that my nail bed is translucent and it is pink. I'm going to check the capillary refill by pushing on, making sure that it returns in 3 seconds. I'm also going to make sure that there is no excessive thinning, that my thickness of my nails are normal, and then I'm also going to check the shape of my nails by doing this test, making sure that I have a diamond shape, which shows that there is a lack of clubbing. And that's all for the first part of my assessment. Now I'm going to move to the head, eyes, ears, nose, and throat portion of my assessment. Starting off with the head, I'm going to inspect, making sure that the head is normocephalic. I'm also going to palpate, making sure that I don't feel any masses or nodules. Then I'm going to palpate and make sure that I do not feel any tenderness in the frontal or the maxillary sinuses. And then moving to the eyes, I'm going to note, make sure that the eyes are symmetrical, the eyebrows and the eyelids are all symmetrical. I'm also going to palpate the lacrimal apparatus, making sure that there's no tenderness or drainage. And then I will move to the pupils. I can use a pen light to make sure that the pupils are equal and they're round and reactive to light and accommodate. Also, I want to note and make sure that the red reflex is intact for the patient. And then I want to also do the visual acuity with the cardinal gazes, and I'll have the patient look at me straight ahead, and I'll do the 6 cardinal gazes. Yep, to make sure that the vision acuity is correct and that there's no nystagmus. Now I'm going to move to the ears. For the patient, I'm going to note and palpate first off and inspect that there's no erythema. I'm going to make sure that there's no drainage as well. And then I'm also going to make sure that they are symmetrical and look and see. And then I am going to, using an otoscope on a real patient, I would look inside the ear, making sure that I note that the tympanic membrane is pearly white, making sure that I note that the bony structures are intact, also making sure that I note the cone of light is 5 o'clock on the right side and 7 o'clock on the left side. And by doing that, I can lift up the ear for an adult and pull down on the ear for a child. And then I can do the whisper test on a patient. I would have them close one ear and I would go to the other side, and without showing them my mouth, I would whisper 1, 2, 3, have them repeat it back to me and do it on the same for the other side. After the ears, we're going to go down to the nose. I'm going to make sure that the nose is also symmetrical, that the nares are symmetrical. I'm going to have them lean their head back and using a pen light look up in their nose and make sure that their mucosa is pink and moist with no drainage or exudate. I'm also going to do a patency test by having them close one nostril and have them smell an alcohol wipe and do the same on the other side. After the nose, I'm going to move down to the mouth, and for the patient, I would have them lift their head back and say ah, and using my pen light. And when they say ah, I'm going to first off note the rise and fall of their soft palate. Then I'm also going to check the mucosa, the tongue, making sure that the uvula and the tongue are midline, making sure that the gingiva and the mucosa and the lips are pink and moist where there's no cyanosis, there's no bleeding. I'm also going to look at their gums, making sure that they have no missing teeth, no caries, making sure that there's no bleeding as well. And then I'm going to move down to the neck portion. And in a normal patient, I would inspect the neck from behind, making sure that there is no erythema, there's no masses, and there's no nodules. And I would start with palpating, starting from the back, moving to the front, making sure that there's no rigidity. I can start with the trachea, making sure that it is easy to be replaced, that there's no tenderness. I can make sure that I feel that the thyroid is non-palpable. And then also I can do their TMJ if they open and close their mouth with their jaw. If I feel any crepitus or crackling, noting that there is TMJ or not. And then I'm going to move to the lymph nodes. Starting from we'll start from the front. I'm going to start with the pre-auricular, post-auricular, move down to the occipital, down to the posterior cervical, and then I'm going to start up in the front, submental, there we go, submandibular, jugulo-digastric, move down to the superficial cervical chain, then the deep cervical chain, and then move right to the supraclavicular, making sure that I do not feel any nodes and there is no lymphadenopathy. Now I'm going to do the musculoskeletal portion of my assessment. Unfortunately, I don't have a patient, so I'm going to do the best on myself. Initially, you want to watch the patient's overall posture, their gait, and the symmetry of their joints, their muscles, and their extremities. So you can watch your patient walk, assessing their hips, making sure their hips remain aligned. You can also look at their muscles, making sure they're the same size, and you can also watch and look at the extremities, making sure that they're the same length. To check a patient to see if they have scoliosis, you want to make sure you check their hips, their scapula, and their spine. You would have them turn to the side like this. You would inspect the hips, making sure they're aligned. And as the patient goes down, you want to run your fingers along their spine, ensuring that it remains straight and also ensuring that the scapula remains leveled. And you do that as they go down and as they come back up to inspect for scoliosis, any curvatures of their spine. Now moving on to the range of motion, you want to make sure that you note the active and the passive range of motions. You also want to make sure that your patient's movements are fluid and there's no rigidity or crepitus. So starting with their neck, you can do flexion, extension, and circumduction. Then for their shoulders, you can do elevation, depression, and circumduction. Next, you can move to their arms and their wrists. You can do flexion, extension, and then circumduction. And for their hips, you can have them do abduction, away, adduction, back to the body, and then circumduction. And for their legs, you can have them stand and have them flexion, extension, and then circumduction. And then for their ankle and their feet, if they're hanging off of the bed, you can have them do dorsiflexion, plantar flexion, and then circumduction. Also throughout these, you can do strength tests as well as grip strength tests. And you also want to note if the patient complains of any pain when they do a certain movement, and continue to make sure that their movements are fluid, there is no rigidity. Now I'm going to do the breast and testicular exam portion of the assessment. For the breast assessment, you want to make sure that you drape your patient, covering everything but what is needed to be seen. In order to educate your patient, you want to help them realize to note the changes in size, shape, symmetry, color, making sure there's no erythema, there's no edema, there's no drainage, and there's going to be no retraction. So to help them perform their own self-breast examinations, you can have them tell them to stand with their hands on their hips and to lean forward. When they do this, make sure that they know to look for any dimpling or retractions. If they're at home, you can also tell them to lay on their bed, putting a pillow behind their scapula and lifting one arm up to make it more comfortable, and also it's exposing more of the breast tissue that they can feel around, and they're going to be going in a striped pattern using their fingers to palpate. For the breast exam, you want to also tell them that the best time to do it is once a month, every month, and they need to start whenever they start having their menses. That's when they need to start giving themselves breast exams. And the easiest way to do it is 7 days after their menses, to make sure that their breasts are not too tender and not too full. For a breast exam, you also want to let them know that their breasts are going to be a little bit asymmetrical, but you want to make sure that if they do squeeze the nipple, that there is no drainage and that there is no erythema when that happens. When they're palpating, you also want to let them know to check the tail of Spence area, which is underneath their armpit, making sure that they know that that's the most important spot, because that's where nodules or lesions mostly occur. For the testicular exam, you also, whenever you would give it in the hospital or anywhere that you're working, you also would want to cover the patient, draping them in every form or fashion, making sure that only the area you need is exposed. Educating them, letting them know that they also need to start when they hit about puberty, and the easiest time for them to do it is also once a month, but after they get out of the shower, making sure that their testicles are more relaxed. You want to let them know that it is okay if one testicle descends a little bit lower than the other, and it's okay if they feel a spongy feel, but you want to make sure that they know to look for a change in size, shape, color, or drainage as well. And they will be palpating with their 2 fingers for the testicles and making sure that they don't feel any nodules or any masses. Now that we have finished the assessment, I'm going to go into the 6 post-procedural steps. First, you want to lower the bed back into the lowest and locked position. Make sure that you raise the 2 side rails and make sure that you put the call light within reach. Then you want to assess the patient for any additional needs and state your time of return. Afterwards, you want to dispose of PPE properly. Then you want to clean anything that you use to touch the patient. Next, you want to wash your hands, and afterwards you want to document. Make sure you mention the date, the time, the assessment, the procedure, and any response that the patient had to the procedure. I hope you enjoyed the video.